Deciding to come to McMaster and take their accelerated program was a big decision for me. I really wanted to further my education in an area that was going to be enjoyable but also was focused on student success. And the approach that McMaster takes to student learning is, to me, much more personalized than some other schools, and being able to self-guide but also being supported in every step of your education is extremely important to me, and Mac just stood out as the #1 choice for that.
What I find unique about the nursing program at Mac is that, unlike other programs, we as students really have a big opportunity to direct our own learning, and we even get a chance to teach some of our classes based on evidence, based on the literature. So we really get to learn how to learn and also learn how to teach. When we get out there in the real world, like standards change, protocols change, and I feel prepared to kind of go through that learning process again, not just right after I graduate, but 10 years from now.
I chose nursing at McMaster because I liked the opportunity to be exposed to pediatrics, which McMaster was and is heavily involved in. And in addition, I chose McMaster for the small student to teacher ratios and being able to contact your teachers and get the support that you need.
Honestly, one of my favorite things that I find the most unique about Mac is probably our PBL class. So the problem-based learning concept, I think, is pretty specific to Mac. It's a class that we take that is kind of like structured by the students. So we get to listen to each other's experiences and learn from them, and that's kind of the basis of our discussion. It's not so structured in a way where we go to class and we get lectured. It's more like us guiding our learning, which is really beneficial for nursing.
During my studies here at McMaster, I've worked with 3 different professors, one in a qualitative mental health research project, one in a quantitative project where I studied population-wide data in terms of diabetic statistics and prevalence between different LINS populations.
So the reason why I chose the accelerated program here at McMaster is because I was looking for something wherein I could apply the knowledge that I got from my previous degree, which is also here from McMaster, biology and psychology. And I'm looking at certain options, and most of them ended up being like lab work. However, I was more interested in applying the knowledge that I had in terms of a healthcare setting, and I looked into nursing, and I noticed that it's catered towards those who already had previous experiences in the undergraduate program.
The accelerated program at Mac has really prepared me to be a nurse by giving me good examples of what good nursing is. The tutors they have, especially in clinical, the tutor I have right now is exactly what I want to be. He's very knowledgeable of the information, but he also portrays himself in a friendly manner to the patients. And that's exactly what I want to be. I want to be the face that the patients want to talk to, develop a good relationship, as well as getting the work done, knowing what I'm doing, and doing it efficiently.